is a hybrid board meeting. Some presenters and guests will appear in person, and some will appear virtually. For those presenting virtually, please mute your mic when not speaking, and when presenting, make sure to unmute your mic and turn on your camera. For those joining us in person to present, please turn on your mic when you begin speaking, so the green light is showing, and off when you've completed your remarks, so the red light is showing. For all presenters, please state your name for the record before speaking or responding to questions. Our first briefing is on the library staffing plan update. And I would like to welcome Annie Lewis and her team to the dais to begin the briefing. Good morning.
Good morning, Chair. Good morning, Commissioners. My name is Annie Lewis. I use she and her pronouns, and I am the Library Director. And I'm here with my colleague, Dave Ratliff, if you'd like to introduce yourself.
Hi, I'm Dave Ratliff. I am the Interim Deputy Director for the Multnomah County Library, and I use he or they pronouns.
Well, good morning, Chair and Commissioners. We're here today to provide an update to you all on the library's staffing planning efforts. Next slide. Today we're going to cover the background on why we're here today in terms of the library audit and recommendations within that audit that brought us here. And we'll cover sort of a background around the library's efforts to develop a staffing plan, which is preparing us to be ready to fully open our new library spaces at the conclusion of the library capital bond effort in late 2026. We'll cover the background on the staffing plan, how we've developed our staffing plan, some key impacts and expected changes to come with the implementation of this plan, as well as a timeline and overview of our next steps. Next slide, please. So why are we here today? So in 2023, you'll remember that the Multnomah County Auditor's Office conducted a performance audit of the library. That culminated in a report which was released in December of 2023. And that audit included a set of 10 recommendations that the library is actively working on addressing. And in fact, the Auditor's Office right now is in the progress of their review of the status of these recommendations. Recommendations 9 and 10 in that audit report direct the library to develop a staffing plan that addresses staffing needs in library locations after all new buildings open to the public in 2026. Now, although this recommendation was included in the library audit, the library has been planning our staffing needs for years. And so we'll today share sort of a background on that planning progress and effort. But first, we'd like to show the recommendations from the library audit so that we can understand what's included in there. Next slide, please. As I said, recommendations 9 and 10 from the library audit direct the library to develop a staffing plan for fully staffing our library buildings when construction is complete. And at this point in time, we anticipate that construction will be complete for all new buildings included in the capital bond in late fiscal year 2026, so June, July of 2026. The staffing plan, as recommended in the audit, is addressing, and we are working towards addressing security and coverage for security and person in charge requirements, fully staffing our libraries so that they can remain open and have stability in terms of operations. The audit also recommended adequately staffing so that community engagement, programming, outreach, and events can increase, while also addressing employee concerns around workload and such. Additionally, we're addressing cultural and language skill allocation by position and location. And the last piece is sort of outside of the staffing plan, is just a note around sort of how we recruit and making sure we're allowing time for filling vacancies and hard-to-fill positions. And why we're here today? Well, the audit recommends that we communicate our progress on the staffing plan to employees and to the board twice, both before our library buildings open to the public and after all of our spaces are open. So we're here today to provide an update to you all on this progress. I will note that the requirement from the audit was that we present to the board by October 1st. For various reasons, we've pushed that date out to today. Today we're sharing an update with you on the staffing plan, The final staffing plan, however, will be complete by mid to late January because it's inextricably tied to our budgeting process, and we'll be submitting the staffing plan changes within the FY26 budget submission. Next slide. As you all, hopefully are aware, we have been in the midst of a very significant capital bond project. So in 2020, voters approved a $387 million bond measure to update and modernize our library facilities. And as you all are aware, that effort has involved extensive community engagement to help inform the building design and the services that will be available within our new spaces. Our new spaces are going to bring new amenities to our library, to our community, that we need to ensure we have staff equipped and ready to be able to provide those services. In addition, the bond is expanding our library spaces. So our library buildings will be larger and require additional staffing to be able to fully operate the buildings when they're open to the public. The staffing plan, as I said, is in progress right now and will be completed in late January of 2025. The majority of the staffing plan changes will be incorporated into the FY26 budget, as I said, and we will implement those throughout fiscal year 2026. So some changes will take place earlier in July of 2025 and throughout in preparation for the opening of all of the library buildings, most notably the East County Library, which right now is on track to open in late spring of 2026. Next slide. So why do we need a staffing plan? I think I've covered it a bit, but I want to really just underscore that adequately staffing our library locations and virtual customer service will ensure that we follow through on the commitments we've made to voters in the Library Capital Bond Program. Additionally, our staffing plan is designed to address to provide clarity around the services the library is committed to providing into the future. The library, Multnomah County Library, due to our smaller spaces over the years, has invested heavily in services that are delivered outside of our library buildings. And that's important, but as our library spaces expand and we're able to provide new services within these spaces, we will be shifting priorities to really ensure that we're fully providing the services that we've promised to voters through the bond program. Additionally, the staffing plan is really helping us prepare for the future by making decisions proactively before we face long-term budget constraints. Additionally, the staffing plan is really designed to help address some areas of opportunity around efficiency within our organization and how we design workflows to most efficiently and optimally deliver services for the public. Next slide. Throughout the planning process, Dave's going to share a background in terms of process so you understand how we've developed the staffing plan, but I wanted to share briefly about how we've kept staff informed and engaged during this process. So we have communicated regularly with library staff throughout the process of developing a staffing plan through bi-monthly email updates. Additionally, information about what we call the Future Staffing Initiative is on our library commons and our intranet so that staff can stay informed about what is happening. Additionally, Dave and I have hosted regular virtual library town halls where we share information with library staff about the planning process and answer staff questions about the information shared. We also provide regular updates to Local 88 leadership during our monthly check-ins. And we're also committed, as we roll out and implement this plan, to keeping library staff informed as the plan is finalized. Next slide. So now I'm going to turn it over to Dave to give you some history on the library staffing planning efforts so that you understand how we got here today.
Okay, and I'm ready for the next slide, please. Thanks. So believe it or not, this actually started more than 5 years ago, and we knew even then that we needed to make some changes, largely with our classifications. We knew that we needed more folks performing the duties of library assistants, and that the duties of the clerk were really changing pretty dramatically back then. So our HR director, Jeanette Easter, and I at the time had a joint management task force, labor management task force with Local 88. We spent an entire year actually developing recommendations, and we actually reached consensus, which I was a little surprised at, to be honest, but super thrilled by. And one of those recommendations we just recently implemented in 2023, which was actually discontinuing the library clerk job profile and making those folks LA's library assistants so that they could perform what we actually needed them to do. Shortly after that task force finished its work, we went like right into the pandemic. And so that really kind of slowed things down, but we're getting there. Shortly after the pandemic, and once we had all the buildings open, we had a fairly major public services management realignment where I think all of us ended up in completely different jobs than we had had before, but it was getting us, headed in the right direction for where we are now. In 2023, we launched our work with the consultants from Tusk. And where we are now is that we're finally in the process of finalizing this plan, which is pretty exciting. It's also a little bit daunting because we have about, a month or less left to get to like really wrap up many years worth of work. In January, we'll begin working on the deeper details, which we're calling the blueprinting phase. And that's really getting into deeply into workflows and processes and exactly what each individual position becomes, particularly within our community services department where things are changing the most. And then, of course, we will implement that starting in June so that when we open the East County Library, we're all ready to go. Next slide, please. So the future staffing initiative work included lots of key steps, many of which were performed with Tusk and management together and also staff. So we first had a document review and then stakeholder interviews. We had staff engagement, which included service mapping and site visits. There were almost 60 staff who participated in those sessions, and most of those participants were represented staff. There were planning workshops with the executive staffing team, and we're now at the point where we're starting into what we're calling the implementation support, which is mostly coaching and capacity building for line managers of the most deeply affected work units to help them be successful and to help them keep their folks successful. And that's it for that slide. And we're moving back to Annie. I'm also supposed to talk about this.
Could you please turn on your microphone?
Oh, I'm sorry.
Thank you.
My apologies. So the first step was calculating the FTE requirements for new and existing library buildings. We've been done with that for a while now, but we're still working on how we're actually going to fill all of those position needs. We have a language and cultural knowledge, skills, and abilities assessment that was completed a few months ago. That was an assessment of the current state that we're in right now that involved a lot of staff input and a lot of recommendations that came forth from staff. We will be adding those into the blueprinting phase where we'll actually apply them and make the changes. And so where we are right now is we're really discussing in pretty great detail. In fact, we're almost entirely done with this. Recommendations to managers so that they can tell us what they think we've missed, what they think needs to change, and where there are some minor adjustments to still be made in the process. And then we'll go on to, as I mentioned earlier, the blueprinting phase where we get into the actual workload of everything.
Next slide. So I'm going to share a couple key elements of the staffing plan that have provided a foundational basis from which we have developed our FTE requirements for the services the library provides. So one of the pieces that was fundamental to the development process was to articulate, what does a library do? Like, what services do we provide, right? We're a public library. Obviously, we provide books and collections, but we also provide a lot more than that. And the library plays a key role in the community that is unique, but also situated within a broader educational ecosystem within the county. And so in order to really clearly define what we staff it for, we needed to clearly define what we do, what are our priorities. And so part of this effort included developing what we called the library service statement and priorities, and that was included in your packet. It's a separate document that really articulates what the library does. I'm going to share sort of an overview at the very high level of that, that key element. Next slide, please. So what are the library service priorities? So what you'll see here is in order of priority, a high-level sort of categories of what the library does. So fundamentally, number one, the library provides spaces. We provide libraries, buildings that have collections, technology, direct customer service, and more amenities where people can gather, connect, and be in space. Second to that is to provide information and referral services, and that includes both within our library spaces, but also remotely. We provide referral and information services through our virtual customer service channels, including by phone, by chat, by email. The third priority is to provide a library website and public access catalog. That's how the public accesses our collections, understands what services we provide, and is able to interact with the library 24/7 remotely. And lastly, the library provides programs and activities for literacy, creativity, and learning. And that category is a broad sort of category that encompasses things like library story times, literacy-based services, reading development programs, summer reading, technology classes, and more. So these service priorities are listed in order. And so the way that we focused on I'm actually going to go into this on the next slide. So go ahead and go to the next slide. So before I, get into the criteria for the service priorities, I also want to underscore that we, as part of our underlying or overlaying the service priorities, is a key commitment to equitable service. So the library is committed to ensuring that every service we provide, whether it's library collections, information and referral services, the library website, or programs and activities, are approached through an equity lens. And part of this planning process involved introducing the concept of targeted universalism. Targeted universalism is not a new concept. It's a new term at the library, but it's not a new concept in terms of practice. So the library's been committed to using an equity lens in the way that we ensure our services are accessible for the entire community. But through this staffing plan, we're really underscoring our commitment to ensuring that every single service we offer is designed for the variety of communities that we serve and the individual needs that those communities have. So examples of the ways the library is currently doing this includes cultural responsiveness. So for example, in the staffing plan, you'll see allocations of positions with language and cultural KSAs on positions to ensure culturally relevant services, in addition to language accessibility. Also physical access, addressing psychological and emotional safety, then developmental needs of the communities that we serve, as well as introducing trauma-informed practices. Next slide. So as I shared, we developed our service priorities, and then in order to develop the staffing plan, we developed criteria that would be utilized to develop the FTE requirements for each of the criteria that was developed. So I'm going to go over these briefly with you all. Next slide. So the staffing plan criteria, this is spread across two slides, is listed in order to cover each service area. And the way we approach the development of the plan is to first start with number one, which is ensuring that we have adequate staffing levels for our library locations so that they could remain open consistently for the public. So first we had to meet that. So we developed FTE requirements for staffing levels for locations. Then next comes ensuring we had adequate staffing levels for substitute staffing to ensure we have coverage during leave or unplanned absences. Embedded in our staffing levels for library locations is also allocation of staffing for language and cultural KSA skills. So our staffing plan will include those specific allocations across libraries that serve specific community, where we have concentrated communities who could benefit from cultural or language-specific services. Then next is our integrated services staffing, which is our materials movement staffing, our sort center staffing, as well as our technical services teams who do all of our collection development. Next is outreach. So while we are committed to prioritizing services within our library buildings, we also know that there are many community members who have no access to physical libraries, whether that's because they're in an institution, such as they are incarcerated, or in a facility where they have physical mobility issues and an inability to get out of their environment. And so we have ensured that our staffing plan addresses outreach services such that we can deliver library services to those who have no access to library services, library buildings. And then next is adequate staffing for security. Now I want to emphasize that security is addressed within the number 1, which is staffing levels for library locations. Because in order to keep staffing open for our library locations, we have to address numbers of people who can serve as a person in charge. And so while adequate staffing for security is number 6, we see these as all sort of together because our library locations cannot stay open without adequate staffing for security. So our staffing plan includes adequate staffing for our PIC model, as well as planning for contracted security. Next slide. And then lastly, we get into the programming and activities. So at the core, we offer the library services that are provided within our spaces, but we also offer activities and services for the community. And so we've listed these, we've developed a list of those services at the high level, and our plan is addressing adequate staffing for us to be able to provide these services within our spaces. And I'll emphasize that many of these services are provided directly by library staff, but also services are provided through partnership. And we'll emphasize this on some coming slides, but one critical sort of fundamental piece of our future planning is really leveraging partnerships such that our library spaces can be utilized by community members, by community organizations who have expertise in areas where library staff may not, but that leverage the expertise within the community such that we can meet people where they're at with the services that they need. Next slide. Okay, so our staffing plan has some key dependencies that are important to understand, particularly as we work to finalize the plan for the FY26 budget submission. Dave?
So as Annie said, there are, as we finalize the staffing plan, it's important to note that there are several things that success is contingent upon. Some of these factors that could ultimately determine the feasibility of the plan and whether or not changes or future adjustments are needed are on the next slide. So if you could move to that one, please. We are currently at the tail end of market rate adjustment bargaining, or at least we hope we are, with Local 88. And that will lead to some changes in terms of both our budget, but also in terms of actual classifications, particularly at the librarian level, in which there is a proposed senior librarian classification coming into existence potentially by 2025. Yes, thank you. We are also, as of last March, in a place where nearly 2/3 of library staff have opted out of serving as the person in charge. That is something that was not possible prior to the 2023 contract. But now that staff can choose to do that, we're going to need to make changes to ensure that library buildings meet minimum PIC coverage during operating hours. And that coverage really depends a lot on the location, the complexity of the work that occurs there, the size of the building, and to some degree the clientele based on the neighborhood. Locations with a lot more kids that are a lot more busy all day long take a little more effort to manage. So we're working on making sure that all of that gets covered. Next slide, please. Unfortunately, we have no surplus revenue to support new net staffing. So with very few exceptions, we're not going to be able to add new positions to their total. We will use vacancies and limited duration positions to meet our short-term needs, but most of what we change will come from reallocating our existing staff positions, many of which are currently filled. Our top priority, as Annie said, is to keep locations open, and we need to meet minimum staffing levels in order to keep our buildings safe. There are some new technologies coming, and those will be throughout the system, including almost every location and our behind-the-scenes sorting facilities. That will change the way staffing works in terms of materials movement. So the way we transport books, the way we check them in, the way we check them out, what moves around the system and where is all going to change pretty dramatically based on having automated materials handling and also a software system that automatically allocates materials to where they're needed, which is pretty exciting. Instead of having the shelf where the most popular items are be empty because they're all checked out, this will automatically fill them on a continual basis. But that's going to make a lot of changes for the way things look. And we don't know exactly what that's going to result in staffing-wise just yet. We also need our staffing plan to account for absences. So we are creating some kind of a last-minute system to fill critical positions when there are illnesses that would otherwise cause us to have to close the location potentially. If we don't have enough picks because a couple of people got the flu this week, or heaven forbid we have another round of COVID, we need a whole system to make sure that we have somebody who we can slot very quickly into those positions. Next slide.
So I'm going to briefly go over some key impacts and expected changes. I will note that because we are in the middle of finalizing the staffing plan, today we're not going to get into position level detail or service by service level detail because we're still finalizing those decisions. And it's critically important that we communicate to staff who are impacted first before we share information publicly about known position changes. But we do know at the high level where we're going to see some key impacts and changes. So I'm going to go over those with you today. The first slide, though, that I'm going to go ahead and go next slide, I want to talk about is work that's still in progress that will continue to influence further changes in the staffing plan in future years. So as Dave shared, one of the elements of our staffing planning process has been to conduct an assessment of the Language and Cultural KSA program. And what that really means is we engaged all staff with a language or cultural KSA on their positions to understand their experiences in their role, their understanding of their role as a staff person with a language or cultural KSA, where they see opportunities for structural improvements or role clarity. And so we have finished the assessment, and through that have developed recommendations which will be implemented over the course of 2025-2026. You'll note that the audit required us to articulate a plan for allocations of staff with language or cultural KSA positions. And the plan will do that, but we do expect that there will be further changes because there's a couple key things that are happening. One is that we're just in the process of finalizing a contract with Portland State University's Population Resource Center to develop a data set that will enable us to utilize their population data overlaid with patron use data so that we have a better understanding of the demographics of patrons who are utilizing each library location, such that it can better help us understand how to really strategically focus culturally specific or linguistically specific services in locations. So we may make some adjustments in terms of the language or cultural KSAs that we have in each of our locations based on that analysis of that data, in addition to further staff engagement. We are also in 2026, in the fall of 2026, 2025, I should say 2025. In the fall of 2025, we will be conducting our patron survey which will be different than in years past. Instead of just a survey that produces a quantitative data set, we will be doing focus groups with priority populations, particularly communities who have been underserved by the library, to help better understand the experiences of patrons who have been historically underserved. And that may further influence further changes in services and staffing. So I just wanted to emphasize that we'll continue to evolve as we go into the coming years. But this staffing plan is really going to be introduce the significant changes within 2025 with some potential future changes. Going forward? Sorry, next slide. So at the high level, what we're going to see in terms of the changes that are coming within the staffing plan is we will see fewer specialty programs provided by library staff. One of the things I shared before is that the library has really invested in providing services out in the community because of our small spaces, and that has resulted in some positions that are very highly specialized, which then further limits our ability to be adaptive and nimble in terms of providing the core services that we have committed to providing to the community. Where we'll see sort of the most staffing shifts is within our community services work unit. And that's the work unit that focuses on providing services, outreach services out in the community. We'll see a focus on more in-library programming now with our with our larger meeting rooms, our larger spaces, and the new services available in there. And then also a focus on leveraging community partnerships. So really working on developing contracts and or partnerships with agencies where we can provide our library spaces and where other organizations can meet people at their point of need to address key service needs that may be out of scope for the library, but that we're seeing present within our library spaces. Next slide. So in terms of timeline and next steps, as we said, we're just in the process of finalizing the staffing plan. And we expect that we will be sharing the staffing plan with all library staff by mid to late January. You can go to the next slide. Prior to the rollout of the full staffing plan with library staff, we will be doing individual communication with staff whose positions are impacted. And then we will be submitting the staffing plan changes into the FY26 budget submission. Then after that, we'll be implementing what we're calling the Organizational Blueprint Project to really focus on implementation of these changes, development of workflows in light of service changes. And we'll be implementing the staffing plan throughout 2025, with some changes happening earlier in the year and some changes happening a bit later, understanding that East County Library opening is really the huge driver on making these staffing changes. So that's the end of our presentation, and we're more than happy to answer questions that you may have.
All right, thank you so much. Really appreciate this, Annie and Dave. And we will go to the board for questions. We will start with Commissioner Stegman. Good morning.
Good morning. Thank you, Chair. Good morning, Annie, Dave. Thank you for being here. And Annie, thank you so much for the recent tour of Fairview and Troutdale and the East County Library. Oh my gosh, it's so exciting. So I had a couple of questions. I noticed the self-checkout when you gave me the tour. Are those at all of the libraries, and are those kind of reducing the amount of personnel that we need, or because it seems like it's I know at the smaller libraries it's more of a convenience more than anything.
Yeah, Dave, do you want to answer that question?
Yeah, what I would actually say is that it hasn't reduced the personnel that we need, but it's freed people up to do different things. So when I started here 20 years ago, the vast majority of our circulation took place person to person, and that meant taking up your book to somebody and spending time with them to actually get through that entire process. We did have some self-check machines, but in that era, they didn't work very well. And they froze up a lot, and people had a tendency to just kind of ignore them because they weren't very pleasant to use. What we have now is vastly superior, and of course there are still some folks who prefer to speak face-to-face with people, but that really did lead to a lot of what changed. When I was mentioning we didn't quite need as many clerks and we needed a lot more library assistants, that was very much related to self-check in many ways.
And also to answer your direct question, which is we have self-check machines in every library location.
Great. Well, it's kind of like, I don't know, I guess like going to the grocery store, like sometimes you want to go through the self-checkout and sometimes you don't. So I think, just having that option is really good. How many So we're going to be shifting some personnel from library clerks to library assistants, and I'm wondering how many staff that affects, and then what is the commensurate pay that goes with that?
I missed the last one. Oh, commensurate pay, yeah. So as I said, we're still finalizing the staffing plan, but right now, just to give some broad numbers, we expect, let's see, I'm gonna do quick math in my head. About 40 positions to be impacted, and the realm of what I mean by impacted includes, I think 45. What that includes is, in some cases, it's reassignment from a work group to a work group. So staying in the same classification, but moving from one work group to another. The other category of change is vacancies, right? So with vacancies, that also includes reassignment of vacancies, but also in a number of situations, reclassifying vacancies to meet our future needs. Additionally, there will be a very small limited number of positions that are changing classification. I'm happy to say that the number of positions that we do anticipate need to be downwardly classified, so demoted through a reorg, is very small, but there are several positions in that category. At this point, it's about 5 positions, including represented and management positions, about 5 positions. And then we, as I said, we do anticipate changes to several management positions as well. So either reassignment to different work groups or a downward classification. So those are the anticipated changes right now. We're still in the process of finalizing. And as a reminder, we have I don't have the number in front of me, 643 budgeted positions. Mm-hmm.
Okay. Well, that's unfortunate to see, but I realize that just the nature of what we need and where we need is something that we're having to deal with right now. I'm also wondering, what about the absenteeism rate? Like, are there metrics, and like, how do you plan? I think you talked a little bit about like COVID, but even I'm just thinking like every day, like what is that succession plan on a daily basis? If you only have, I don't know, 3 or 4 people staffing and 1 or 2 of them call out, what does that look like for coverage?
And at the moment, it's not great. It's pretty difficult. We have folks spread pretty thin, and we don't have a robust system of backup folks who can run in and cover those shifts. So that is one of the things that we're definitely trying to change. We do have metrics on sick leave, and that was part of what we used to calculate what we needed in terms of a last-minute coverage pool. And I think we're going to end up with roughly 19 positions, something like that, we're hoping for, to do nothing but that last-minute coverage throughout all 19 locations. So. And we'll probably, we don't have all the details worked out, but we'll probably assign those somewhat regionally so that we don't have somebody who needs to get from Troutdale to St. John's.
And I'll add, Commissioner, that the library has implemented various models of substitute staffing over the years. And we've, in the last several years, had a management task force that was charged with evaluating different models for substitute staffing. I think each of them comes with costs and benefits and their own challenges, but we are likely moving back towards a model where we have filled permanent regular status positions that act as substitute staffing, so that we're not solely relying on temporary staffing to meet our last-minute vacancy needs. I'm sorry, not vacancy, but absence needs.
At the moment, we're relying a lot on actual on-call staff. The problem with that is that a lot of those folks don't take last-minute shifts. That's the stuff that gets covered for vacations and things that people can plan for in advance. And understandably, those folks also end up being on vacation when everybody else is on vacation. They're off on the holidays. They're off in the summer. So we're just kind of reconfiguring all of that to hopefully resolve those issues.
Great, thank you.
And then Commissioner Stegman, I want to keep us on time today since we have some special things happening at the end.
Okay. So just maybe one last question about, so in the slides it said that there's going to be fewer specialty programs. And what are those?
So I'm not prepared today to go service by service, but in the broad category, we will be reducing services that are right now provided fully out in the community and that have developed specifically for specific types of organizations or specific audiences. We're really looking at that through an equity lens in terms of prioritizing those who have really no access to library services, pulling back on services where folks may have access or means to be able to utilize library services, but where we have been delivering on site. So I will be able to share more specifics about kind of services, specific services once we finalize the staffing plan.
All right. Thank you so much. Appreciate it.
Thank you, Commissioner. Commissioner Brim Edwards.
Appreciate the presentation and also the deep dive on the staffing piece and how it's being implemented and getting it sort of at the midpoint, not necessarily at the end. It's helpful to see that. I had just two questions, given how detailed the materials and the presentation was. One, this is like a broader question and relating to the budget. So with a constraint this next year, will you still be able to implement the staffing plan without reducing the services that are provided?
Great question. So a key reason why the staffing plan isn't totally complete is that it's linked right with, in the budget process. So we are, part of our staffing planning has been planning for constraints, understanding our forecast, right? And so we're really working, we've had to prioritize services such that we focus on keeping library spaces open. So we, in terms of the audit recommendations, there's the audit recommendation that we staff such that programming outreach events can increase. We will not be able to increase in every service area according to that audit recommendation simply because of limited resources. And so we will see service reductions in some areas in order to actually increase services within our library buildings, the new services that are brought with the bond program.
And how will you prioritize what gets increased and what's decreased?
I think, so that was covered in the sort of the priorities section where we focused on first making sure we have adequate staffing for library spaces, virtual customer service, our library website, and then programs and activities. And the programs and activities category, so every service, those are all scalable, right? So the services that we offer that staff provide, such like story times or technology classes, those are very scalable, right? Where library buildings are not scalable. I mean, unless we reduce
So you can turn the dial up and down.
Yeah. And so that's kind of how we've prioritized, and then within that, applying our values around equity to identify those reductions.
Okay. I'll be interested to see sort of how that flows out because we have beautiful new libraries and I think the community values them and will want to sort of see how we sort of maintain a level of services even in times of constraint. So my other question, it's around slide 14, which is the equitable service delivery. And I'm curious about how you will know that you're reaching more diverse community members and that you're actually achieving your goals.
That's a great question. So we have a couple planned efforts in the coming years where we will be conducting deeper community engagement with priority and focus communities. So that includes in 2025, the patron survey, which will be focus groups with populations who are underserved. And so we hope to learn out of that, that process how we're doing. Like, are we meeting our goals? Are we developing services that are accessible, responsive to the individual needs of communities? So that survey effort will launch in the fall of 2025. And then we also will be launching our next strategic planning effort, and that will also include robust community engagement, such that we will be prioritizing communities of focus for engagement so that we can understand how we're doing, but also what folks want from the library for the future. So both of those efforts will help us better understand and continue to evolve our services.
So it sounds like those are primarily like qualitative measures, focus groups. Do you have any quantitative metrics that would tell you? I mean, I'll just say, from a qualitative standpoint, when I went to the library openings and you go to the libraries, it seems like you're reaching a pretty diverse population in our community, but I'm curious, is there a way to quantify that?
Yeah, so our current patron survey, the 2024 patron survey, included optional demographic data. So that's one way that we can understand, and that survey data can be disaggregated, and so that we can understand responses across different demographic groups. We do not collect demographic data for people who walk into our buildings. So that does make it more challenging for us to understand sort of who is using our spaces on a day-to-day basis. We do rely on the sort of patron survey and other engagement efforts to help us understand. It's a long kind of conversation, but patron privacy is a key value of the library, and so there's been we have not, as of yet, collected demographic data more broadly of people who are using the library beyond language access needs and language preferences.
Yeah, I'm wondering, like, we have really diverse collections in a lot of different languages. Do you look at, like, just the turnover of whether items are being utilized, or?
Yes, yes. Dave, do you want to speak to that in terms of how we use collection data to inform decisions?
Yeah, so our collections in languages other than English circulate extremely well. And we actually have trouble getting enough materials in those languages. So we know that there's a demand for those that is almost impossible for us to meet. Those materials are not as readily available in the US. They are far more, they're far more costly, and they're far more difficult to find. So we put a lot of effort into finding kind of that smaller chunk of the collection, and it gets used exceedingly well. So it has excellent circulation data. So we're pretty sure, based on that we're heading in the right direction there. We just need to do more.
Thank you.
Thank you. Commissioner Singleton. It's going to take me a little bit.
That's okay. Good morning. Thank you for the presentation and the robust materials. I really appreciated being able to kind of catch up a little bit. You mentioned the opt-in around the PIC position, and it's a pretty low number of folks who are opting in. Do we know some of the why behind that?
Serving as a PIC is challenging. The PIC role is a position that requires someone who is able, willing, and comfortable to enforce library rules and to engage with folks who may not be having their best day at the library. It involves an understanding of our library rules and how those are applied, and not everyone is coming to a library to serve in that capacity. And so while the opt-in PIC agreement has been challenging operationally, I really do believe in the sort of the reason for that, right? That staff should be able to choose that role because it is such a challenging role. So my biggest sense is that I think that there are for a variety of reasons for individual staff members, concern about that safety environment and that ability to operate in sort of the uncertainty that comes with enforcing our library rules, particularly for individuals who may not, like I said, be on their best day at the library.
And so are those positions trained for those particular tasks, and is it compensated differently?
Yes.
Okay.
So part of the opt-in PIC agreement was an increase in the premium that staff receive for the PIC role, and then we have extensive training that we provide for staff who serve in that role.
Thank you. My other question is similar to Commissioner Brim-Edwards. When you're talking about the future state and the budget and the realities of the constraints, do we know demographically who's being served in the in-library versus the outreach services? Because I'm concerned if it's a lot more diverse in outreach and we're cutting that, then we're increasing disparities.
Yeah, and I think that's been one of the more challenging aspects of this planning effort, because we can't choose not to staff our buildings, right? We have to staff our buildings. And so that's why, in terms of the staffing plan, you're seeing this really strong statement of commitment to equity and sort of introduction of the concept of targeted universalism, because we're committed to really ensuring that every single service we provide within our spaces is accessible for the broad diversity of communities that we serve, right? And if we're not currently serving folks well in a particular demographic, that we're developing further strategies to ensure that they have that equitable access. It is the case that a number of our outreach programs are specific services designed for folks who have some kind of barrier to access, right? And so we will see reduction in services that are advancing equity within the community. And so that's been a really difficult process for us to make those decisions. But we're trying to do it in a way that is as transparent as possible, but also really, like I said, really committing to the core services that we provide to ensure those are accessible and responsive.
Thank you. And I'll just say, when you talked about community partnerships to kind of help augment some of that piece, we don't have to get into it today, but I'd love to spend some time with you and understand what those look like.
Yeah.
And also make sure that we're thinking about compensation for community partners who are kind of taking on county work.
Absolutely.
Thank you.
Commissioner Myron.
Thank you for the presentation. I wanted to, I think any questions I had have been asked and answered. I did want to ask about your approach in targeted universalism as well. I think in the interest of time, I will ask that offline. And I also wanted to just acknowledge my appreciation for the fact that you are really looking into how, into the cultural and language needs at specific libraries in order to identify the best staffing there. And, you know, excuse me, I think you know that I'd done a visit to all of our county libraries in my district and spoke to the staff and met with them individually. And they shared a lot about this. Security was the big thing, and they shared a lot about feeling that there's sort of an effort around cultural and language specificity, but it's not actually, there's no rhyme or reason to it, it felt. Like that there was cultural specificity, but it might not be to the neighborhood or the culture of the people attending a particular library, so, or visiting. And so I'm glad that you're gonna be sort of looking to match those, and otherwise, just thank you for the work. I appreciate it.
Thank you, Commissioner.
Thank you so much, and I just, I appreciate the comments and the questions from the board. I will say that, you know, I know that there has been, hold on. I know that there has been a lot of thought, a lot of engagement, a lot of planning that has gone into the staffing proposal and planning today, and I appreciate the way that you've been trying to be responsive to some of the recommendations that were in the auditor's report, but also building on the work that you have been doing as a library division for a long time. I think that, you know, we really reflecting what these new, big, beautiful spaces that we're having in our buildings because of the way that the voters supported the library system and really made our investments in these spaces is important, because that obviously is going to be a change, but it also is it was such a long-needed and deeply needed expansion of these places where people come to access not just the library services, but just be in community spaces and have access to community spaces. And I think what I saw in this plan really reflects that change. But also, I appreciate the lens of the targeted universalism that you're using in terms of making decisions about what things, as this change is happening, what will continue, what should continue, how it should continue, and just appreciate that. So I'll look forward to more information on the finalized plan, the additional information you'll be sharing with this board as we move into January, and then further later on into the budget process, and just appreciate all the work. So thank you both.
Thank you so much, Chair, and thank you, Commissioners.
Okay, thank you. So we will now move on to a work session on the comprehensive local plan. We're going to stay up here for this because we are going to have a short presentation from the health department. So I want to thank the folks from our health department to joining the board again. This is kind of our final discussion this year on the CLP Plus plan. I really appreciate the continued opportunity to talk with our behavioral health division. The briefings leading up today have provided really important, I think, foundational context for us as a board to understand the complex and the intertwined roles and responsibilities of the counties and of all of our partners in this work. And I think that we've seen that over the last two discussions. It's also really given us some strong footing to understand how we define, quantify, and measure the needs of our community and where we want to grow and go from here. So I'm looking forward to engaging in the conversation today because I think all of that information is really valuable in informing it. I appreciate the Health Department's shift to move this conversation to a work session rather than a board action. I think that the questions and engagement of the board make it clear that additional time for discussions and input from commissioners as the local mental health authority will help strengthen this work as a whole. I know that the draft CLP and the goal, or CLP Plus and the goals and priorities in it have represented and do represent a great deal of work that has already been done in partnership with subject matter experts, community-based organizations, consumers, and peoples with lived experience, other system partners. Again, I want to thank Commissioner Myron for her partnership with the Health Department and all the work of the Health Department on that. On that strong foundation, I am eager for us to spend some time today with you all in discussion and to develop a shared understanding of these priorities and key takeaways. We are going to continue this conversation in the new year with our new board members as well. So I'm going to stop our session this morning on this discussion at 11:30, so we have ample time for our last agenda item of the meeting, but like I said, it will continue. So I want to thank each of you for your willingness to continue this discussion as we continue to move forward, and I will hand it over, I believe, to Rachel Banks and our other members of our Health Department team to get us started.
Hello.
Good morning.
Good morning. Thank you, Chair. Good morning, Commissioner Myron, Commissioner Singleton, Commissioner Brim Edwards, and Commissioner Stegman. It's a pleasure to be with you all again to be talking about the CLP. So also excited to be moving pretty quickly through our comments and remarks for a couple reasons. One, I think we want to get to the celebration of Commissioner Myron, and two, to really hear you all's comments, questions, and discussion. So as the chair said, glad to be able to this morning pivot to a style where we can hear, we've kind of put a lot out there and you've listened to a lot of information, and it's very exciting, and we're very thankful for the engagement and the questions and the interest in digging deeper, and want to continue to have that discussion. Today, I'll just briefly take us through where we've been. Anthony's going to set the stage for the plan. Heather's going to briefly walk through some of the components. And like I said, we really just want to get you all's questions, comments, discussion, reaction, reflection, which we'll then use to have additional one-on-one conversations and come back to the board in the new year. We'll also use that information in our next steps with our CCO partners, some of which may be in the room or will be coming, and other provider partners. Just to say, I want to thank Kelly and team who will be taking notes from the behavioral health team. We'll make sure to capture those notes and get back with you all. But just by way of history, and again, feel very fortunate to be able to be in front of the board 3 times and have this level of engagement on such an important issue. So our first time with you all, and even before that, was just we felt it was important to ground in the system that we're in and the roles that we all play within that system. It is a complex system, and modifications, changes, and growth in the behavioral health system are done in collaboration with a variety of different partners. We know that we can't do this work alone, nor would we want to, because we have the brilliance of our partners in this process. So to that end, you all got a background briefing, and of course, heard from us as we talked through roles of OHA, CCOs, ourselves, community-based providers, which carried us into the second presentation where we came back with you all, and Dr. Mositis shared an analysis for information that this board asked for that really localized and updated some assessment data that was done at the state level, and obviously heard from Dr. Solotaroff as well, of just grounding in what transformation will take based in the historical system and also what we need to be doing, really honestly, and the Health Department and the Behavioral Health Division to be setting ourselves up for success, to be setting ourselves up to close that gap. And so lastly, we're here with you all today to continue to have that conversation and a chance for you all to, as you've digested all of this information, tell us what you think and where you want to see us go. So with that, I'll hand it over to Anthony just to give you an overview of grounding in the plan, what it does and why some of the focus areas are the way that they are.
Okay, and good morning. Before you start, we got a handout, which is great. Is that does Marina have a copy of this that she can share out, or are we going to walk through it together today?
We're going to walk through it together today, and Marina, I will also share with you a copy.
Okay, great. And then Marina, if you can add it to the items for today's meeting. Thank you.
Good morning, Chair and Commissioners. My name is Anthony Jordan. I'm the Senior Manager of Addiction Services. When I walked through the door, it was great to see Commissioner Myron, all the work that you've done. So first, personally, I want to thank you for all the work and the conversations we had over the year. I have a meeting, so I won't be able to stay for this. But, I really respect a lot of the work you've done and all the other plans that was out there. And so I want to sort of set the stage that this plan does not negate or take away from any of the work that's done. What it actually builds upon is sort of the foundational principles that's needed in order for implementation. As many of you know, that for probably since I've been doing this for over 30 years and been in Oregon for about the last 28, the system has been underfunded and the infrastructure as well. And many of our state, local, as well as the county has been siloed, not intentionally. Most of us just come to work. We've been given a list of tasks. We come in, we try to do that. We serve individuals on an individual basis. We never really focus on what it takes for a system for people to get well. It wasn't sort of our system, it sort of was not designed that way. Since I've been here, it sort of felt like a crisis system. Like whatever was shining today, we just ran to it. And so one of the things that we try to do in this plan is really look at what the system needs in order to try to get to sort of what it takes for people to be well. And one of the things we looked at, in order for a system to work, regardless of all the plans that you provide, there's many plans out there. There's been, I've probably been on the ground planning for a long period of time. But every time we get to the plan and the implementation, in order for it to work, what always happens, people say, no one talks to each other. There's not a data system that even support talking or even understanding, is people really getting well? We don't really know. We can go to individual agencies, they can tell you, but from a system perspective, no one can tell you how people are getting well. They can sort of assume. And so what we came up with in this plan is that what we really need is a way to sort of work with our state coordinated care organizations and our providers and try to create a system. Not only from, I heard Commissioner Singleton say about, we can't just do qualitative, we got to do quantitative too, to really know how the experience of the individuals are doing and also what the data tell us, and then make decisions based upon that, not through crisis, because crises are going to come. We need to have an infrastructure to support the next crisis, and we learned that through the fentanyl crisis that we didn't have the infrastructure. So what this plan actually builds on is sort of what it takes for the foundational principles for us to address anything that's going to come up in the future. And I think we came here today just to have a conversation as you as the local mental health authority to sort of help assess what we miss. And that goes for any community members. We met with the coordinated care organizations, but we're still meeting with individuals. And we want to know, in order to put forth a plan, that not only address a plan, but also the infrastructure to support that. So we look forward to the conversation. Thank you.
And Marina, if you're going to pull slides, Marina, if you're going to pull slides, we can start on 6. We really want to hear from you, so I'm just going to do a quick sort of summary of the 3 goal areas on our plan. It's really an action-oriented plan. So
So the first goal of the plan is to build capacity for behavioral health system transformation, with Multnomah County acting as a convener or leader. To achieve this, we have 3 key objectives. The first focuses on developing the necessary infrastructure and commitments, both internally and externally, to ensure a shared vision and track our progress as a system. This involves securing staffing, clarifying roles and responsibilities, and developing a governance structure with external partners. The second objective aims to improve capacity for behavioral health evaluation, analytics, and epidemiology by increasing capacity for data analysis and evaluation, and identifying key population health outcomes, gathering more data that gives us the necessary details to effectively serve all, and in particularly for the most underrepresented communities. The third objective seeks to bring together program and service data reporting sources to maximize their utility in decision-making. This involves identifying and synthesizing, bringing together our existing data sources, establishing a cross-sector team to apply best practices for data sharing, and advocating for policies that reduce barriers to data sharing. It's really good to know that behavioral health has 41 funding streams as a division, and so bringing the pieces together and how reporting goes out to streamline all of that is a really big objective. So Commissioner Brim-Edwards, you had asked about measurable ways to know how we're doing with required core functions. We offered a more thorough written response, but in this area of our plan, this is where we're going to elevate and improve the community-facing way that we present our success with core functions beyond the 278 metrics that we use to report to the state our compliance with objectives. So by building internal capacity, improving data infrastructure, and centralizing data reporting, we will be able to make informed decisions, track progress, and ultimately improve outcomes for individuals served by the behavioral health system. Next slide, slide 7. So the second goal, I've got this in 2 slides, aims to strengthen service delivery and address gaps in behavioral health services at all levels of care. To achieve this, we'll focus on filling workforce gaps, particularly by recruiting and retaining BIPOC providers so that all are effectively served. We'll also support system-level strategies to address the specific needs of community-based organizations and other providers who are recruiting and retaining staff for behavioral health. And then the next slide. Additionally, we'll need to create or support a database to track real-time data on service availability and provider capacity, and improve the use of service data analytics to perform continuous quality improvement. By implementing these strategies, we expect to see decreased vacancy rates in our workforce, improved staff retention, increased ability for community-based organizations to retain staff as well, better connection of people to available services, and improved understanding of capacity and availability, which ultimately leads to a stronger and more equitable behavioral health system. And again, Commissioner Brim-Edwards, with your interest, you had asked about the impact of work shortages on our safety net. We do have a dedicated workforce that keeps us in compliance, but these are the efforts that we need to move to mitigate the impacts of workforce shortage on safety net ongoing, because the need is growing every year. As a result, individuals in need will have better access to high-quality behavioral health services that are culturally responsive and meet their very specific needs. Next slide. So the third goal is to address the underlying factors that contribute to behavioral health challenges. We need to concentrate our focus on prevention and basic needs by addressing our local housing needs for people with behavioral health conditions, improve accessibility and integration of substance use disorder services so that people can sustain their housing. Next slide. We also need to increase youth-focused prevention programming, making it possible for people to connect to services in long-term recovery. Commissioner Singleton, you asked some questions about our engagement in housing and prevention. We did provide a thorough written response, but this is the area in the plan where we give to those needs focus. Ultimately, this effort would lead to increased engagement in services, long-term recovery, and improve outcomes for individuals and communities. If we can get people housed, sustain their housing with the right behavioral health supports, their chance of long-term recovery grows exponentially. Next slide. So our key expected outcomes, we want to achieve a dedicated capacity for really effective system coordination. We've really been service level focused, and there's a real call for our broader system engagement. So we need data that identifies trends and informs progressive direction, better and broader data access for improved decision-making. We're also setting to achieve decreases in staff vacancy rates, expanded access to qualified candidates, and increased ability to retain staff. We're in pursuit of a provider network that's better able to connect people to available services when they need them, a system that has a greater understanding of capacity and availability. We hope to make possible increased engagement in services and long-term recovery for underrepresented communities. So the actions set forth in the CLP Plus are anticipated to build the system that we need. So we're really grateful for your time and really want to hear from you. We've done a lot of partner convenings. We've done a pretty thorough localized system analysis, utilizing what's been done in the past 10 years as well, integrating that in. And this is the space where we get to hear from our local mental health authority and the unique position that you all hold as our Board of County Commissioners and hearing from constituents about what the community needs. So that's it.
Well, thank you so much, Rachel, Heather, and Anthony. Really appreciate all of the work that's gone into this and the chance for this board to continue to have this conversation. So I want to, we are going to continue this conversation, as I said. So I want to really focus on possibly Commissioner Stegman and Commissioner Myron this morning, just to hear, because this is really your last chance to like share your thoughts and feelings. And then if we have a little extra time, yeah, so we will have lots more opportunity, but I really wanted to focus on, because this is something, this behavioral health is, we know, such a huge issue for our community and for the work of the county, and really wanted to make sure that we were able to hear your thoughts and reflections on this. So I'm going to start with you, Commissioner Stegman, and go to Commissioner Myron, because then Commissioner Myron, we will then be able to transition into the next agenda item when you're done. Okay, thank you.
Thank you, Chair. Thank you so much, Rachel, Anthony, and Heather. This is a lot of information, so I'm feeling a little bit overwhelmed. I know you all have been working it really hard, but I really haven't had an opportunity to digest everything. But I'll just call out some of the things that I've mentioned that I'm really excited about. Is we've not talked about upstream and prevention work in the past, and it's about time that we do. And so I really appreciate this. I mean, I think that everything that you have in here, this is the what we need to do. I am just a little bit nervous about the how and the funding, and I know you all are too. So I think this is just so much bigger and broader, and that the new board will really have an opportunity to dig down more deeply. So it's just so very complicated. So I don't really have a lot of specific questions, other than I am appreciative that you all have taken this significant step, and appreciate Commissioner Myron's leadership on this. And this will be an opportunity for the new board to really accomplish something really incredible and great, and make sure that we have a blueprint for how we're going to treat our community, who is so lacking in services. So, you know, helping youth, you know, people that are, you know, have suicidal ideation. I mean, all of those things, it's just like, it feels like just, they're just all out there, and they're not in a way that we can collectively or systematically reach them. And I think that's what you're trying to do. But as you know, there's just so many doors, and there's so many different ways that people need services, and always just kind of keeping our North Star of being human-centered and meeting people where they are. And I know that's something that you all do every single day. So just continue to reinforce that, and I just look forward to this completed plan that I'll have the opportunity to read about next year. So thank you all so much for your commitment. This is a big, big lift, but I'm really grateful. We've got some incredible professionals that know how to do this work. Thank you.
Thank you, Commissioner. I should have mentioned, you know, you were able to provide the board with the plan yesterday, and had said, like, we don't expect you to have read it beforehand. So I just wanted to set that, which we appreciate, because I think all of us are going to be digesting the full plan. Did you have a quick comment? Okay, I appreciate that. Commissioner Singleton.
I just have a quick one. I think I appreciate all the answers to my many questions, so thank you. I still see a lot of gaps between behavioral health and homeless services. And I would like to have a conversation about how you can get more feedback from the folks on the ground. Because if you're not Central City Concern or Cascadia and you have homeless services, you cannot access the behavioral health system. And if we don't figure that out, we're not going to change what it looks like for folks outside and what it looks like for the people in our community who are seeing these behaviors. So I really want to have some space with you all to talk about that. Thank you.
And Commissioner, I feel like this is a really important topic and one that we have, that has come up a lot. I think that is one of the reasons why we set up the homeless response system, so that we could make sure that this cross-sector work that's so necessary for us addressing issues in a really impactful way gets done. So I think I think that's something that definitely be engaged with our health department, but also with Jillian Shoney and the HRS team as well, so that we can, make sure that those things are being connected, and we'll definitely have more updates for the board on that work as well.
Absolutely, and I totally respect the internal county work, but it's the frontline workers.
Yeah.
And the joint office staff don't always have that experience, so I think it's some of the both and.
Yeah, great. All right, Commissioner Myron.
Thank you. Thanks to all of you for your dedication to really diving in to figuring out what our roles and responsibilities are as the local mental health authority and the community mental health, local community mental health program. The local mental health authority is us, the board, which was never really elevated for virtually all of the 8 years I've been on the board, but I tried. And the CMHP is our behavioral health division that does the operationalizing. So policy with us, the board, local mental health authority, and operationalizing with the CMHP, the community local mental health program. And I had come to the board. I ran for office because in the emergency department, I would see people falling through all the cracks in our system and end up in often the most expensive and the least effective, sometimes even less effective than jail to deal with their underlying issues. And these particularly involve mental health and addiction. And so I ran for office to be part of the local mental health authority to intervene upstream so that we can actually make changes so people don't fall through the cracks and end up in crisis or end up boarding in ERs, which too often they do for I'm not sure if they're years, but for weeks and months. And it's really a barbaric system and does everyone a lot of harm. The things that are supposed to intervene to help people too often harm them. And in fact, sometimes kill them. And so I thought I would come to the county and sort of help work on tweaking our system and figuring out what we can do differently. And as I've said often before, it turns out we don't have a system. And we just literally do not. And, for years we may have filed what's called the CLP, Community Comprehensive Local, too many acronyms, as Commissioner Brim Edwards would say, but the Community Comprehensive Local Plan for Mental Health. We're supposed to file that with the Oregon Health Authority. There's been no leadership, a complete void of leadership at the state. And so this has gone just unrequired, and even when it's required, it's checking a bunch of boxes. So it's not a plan, we don't have a system, no one has set up a system. So there isn't one at the county. So that's where I had, when I first came in, sponsored the deep systems analysis, looking, as you said, both that are not just quantitatively, what do we have, what are the objective things we're doing, but qualitatively, how are the people using the system, particularly those most impacted, how are they experiencing it? How are our frontline providers experiencing it? And that analysis revealed that they're experiencing it pretty horribly. They are suffering, both the people working in the system and the people supposedly being served by the system, who too often are living without a roof over their heads, who are on our streets, living unsheltered. So because there was no system, clearly what we needed to do was create a system that was effective. And I've been, prior to coming to the county, been part of those conversations for years. Like, we have talked about this. Commissioner Singleton and I keep giving each other these knowing glances, but the usual suspects are just sort of gathered together and by the politician who happens to come in, and then we meet, say the same things. No one really does anything with them and just throws a bunch of money at the problem and, maybe does some sort of analysis or something that doesn't contribute anything, and then we just move on. The next person comes in and says, I'm going to do something about mental health, and does another gathering of the same people who say the same things. So I was like, not going to do that. I'm going to gather together a small, nimble group of leaders who are doers and who know these systems, who have been at all these meetings, to figure out a strategic approach to implementing what we all know are what we need to do. The analysis I did made 69, I think, recommendations, some very big. So, for example, have a shared understanding of what our mental health system is even supposed to do, which we don't. No one can define it. And, the smallest. So when we got together, this group of 11 folks who were many of the usual suspects, there's maybe the predecessors to some of them, but leaders of our CCOs, our health systems behavioral health divisions, the people with lived experience from the peer community, and frontline providers. This group got together and identified in 2020 8 categories to put the recommendations into, to organize, to create a structure that we could address, follow, and turn into action. So they're the ones basically that are presented here today, all virtually identical. They're identical throughout time for decades, and we just need to do it. So this group got together, created a matrix. We called it a blueprint for better behavioral health. Some of you are in the room who were there at the table, and we operationalized it. We made a matrix that said, okay, here's what we need to do to advance this area. And the next step was to finalize it into an actual system. And that's when it sort of was deprioritized by county leadership at the time and was not followed through on, and was not picked up again until a few short months ago. We have the plan. We know what we need to do. We just need to act. And it's actually not, don't get me wrong, it's a very, very complicated, convoluted system. There are a lot of just intricacies. Anthony, as you meant, like the reimbursement is like, when I came to the county, I asked so many people, leaders in behavioral health, to try to explain it to me. No one could, literally no one. We did an analysis to identify the pieces of it, and we have that, but we don't have a system. That is the problem. And the work we do in our budget, as I've said often, I think I just saw today our budget that's like this big, it's not based on people and serving humans. It's based on program offers that often don't actually tie into real outcomes or services or to each other. They don't create a system, but each year we start with a baseline of like maintain current service level, which means stick with all the program offers and giving money in this ineffective way and try to build on it. Like we say we don't have enough funding, we need more for these program offers. But do we? I would say no. I'd say we have enough money to be able to figure out what we actually need to do and create a system. We actually need to disinvest in many of those items. And we need to invest more on the cornerstones of an effective system. So it's out there. And the county is, by statute, by virtue of where we stand, by virtue of the fact that all of the ties into behavioral health, housing, as Commissioner Singleton said, clearly one of the biggest, housing, our criminal justice system, public safety, all people living outside, our youth, our seniors, all of the stuff we do with veterans, all that we do at the county ties into behavioral health. But we're not treating it as a one county problem. And even if we are saying that we're addressing silos, or even in, say, the HRS, it's not actually cross-sector work. It's still a bunch of check boxes that don't involve these systems, leaders, doers, thinkers, lived experience folks getting together and planning the system that works. And that's what we desperately need. That's what we need to act on. So we need to take up our mantle, and I'm so grateful to our health department for being willing to step up to that challenge. And I know that I saw sneak into the back Ebony Clark, our former health department director, behavioral health director, has done so much of that work before she left for the state. But otherwise, it's been chaos. And there's been turnover that is unprecedented and horribly damaging. There's been a lack of experience and expertise in a lot of the leadership of the department over time. And so we need to get our hands on this because we actually know what to do. The people in the system who live it and our experts know what to do. They have told us. They're just like, please just do it already. And so I'm both really dismayed that at the end of 8 years, I'm kind of sort of saying the same thing that I was saying at the beginning of 8 years, that we invested time, energy, heart, soul, brought so many people to the table, and it's like explaining it again and again and again. And I am hopeful. I appreciate this sort of transitioning as we're stepping off the board. I know that Commissioner Singleton and Commissioner Brim Edwards will be carrying the torch forward. And Chair, you've been here the whole time, so you. But that this, we have to do this, and we have to do it right, and we can. Is the beauty, but we need to set the table, and we need to invest in that shared data system. We need to invest in what I've described as the brain, sort of air traffic control that says, okay, we know CCOs, you have a responsibility, and health systems, you have a responsibility, and like outreach providers, you have a responsibility. Who's putting that together to say, I'll take responsibility and we'll have a system for everyone that works? That's the county, and we can do it. And at this point, it's just completing the work that's already been done. So hopefully it's all laid out, follow the yellow brick road, or, it's there. And so too many people are dying and suffering, being held in jail, sometimes worse, being out on the streets. It's horrific, and we can and must do better. So I would say for me, it's like a just do it sort of thing. Just do it. Don't talk about it anymore. No more like meetings, engage. I mean, we can meet with people, but meet to act and just stop analyzing it. We know what we need to do. Thank you.
Thank you. Thank you. So thank you again to the Health Department and especially Commissioner Myron for your work in pushing this forward. We are going to have more conversation about this in the new year with the new board as well as board action around the plan. And so we will, I know you are already in conversations with some of the board members elect on this, and we have briefings and everything planned with them. So we will, there's more to come, but just really appreciate all the work that's gone into this. And the last 3 times that we have, these 3 times that we have had to learn about it, to get the background in history, to understand the partners, and especially understand our role both as an organization and local government, but also as a board, have been really helpful. And then being able to dig into the meat of the plan so that we have like a really clear path, and not only what we have to do in terms of, the state requirements, which are important, hello, Ebony, but are not sufficient or comprehensive to the real, like the mission that we have here at the department and as an organization and as a board, and the role that we serve in our community. So I just want to thank all of you for all of this work. You have been doing this work. You've actually been doing the work for a long time, but I think the way that the focus is and the plan is, in really recognizing the county's role and how we can move this work forward is, I think, clarity and shared expectation of that all of us are really grateful for. So thank you for that, and more to come. Thank you. So now we are going to move on to our final item for today, which is a really special item and a really sad item, but also, happy. But it is recognition of the Commissioner for District 1, Dr. Sharon Myron. And I will turn it over to Commissioner Brim Edwards, who is going to be helping to be run the program. So I will pass it over to you, Commissioner.
Thank you, Chair. So this is a week of farewells, and today we're going to be recognizing the service of Commissioner Myron, her 8 years. It's bittersweet. I always, having served in elected office and having left public office and then later returning, but when you leave, it's always, well, there's still work to be done. But if you waited for the work to be done, you'd never leave. And so I think it's fitting that this is coming right after the presentation we had this morning and the series of briefings we've had, because what you're doing, Commissioner Myron, is setting us up to continue the work. I know that I will hold your words going forward of we know what to do, we respect the people, the frontline workers who are doing the work, and we need to act and be supportive of them. So I appreciate that even though your time at the dais is concluding, that you've set us up to, I think, improve things at the county and continue the work in a very meaningful way. So thank you for that. So this morning, what we're going to do, sort of just the general run of show, is Commissioner Myron has asked somebody to come to speak, and not so much to speak about her service, but really about the work that's happening here. And with a focus on the work and the people we need to serve. And so the first person that she's asked to speak is someone who's well known to people here at the county, Ebony Clark. She's currently the director of the behavioral health for the Oregon Health Authority. She has an extensive background as a leader in nonprofit and public sector arenas, bringing more than 25 years of experience as an administrator, manager, and clinician. Prior to moving to OHA, Director Clark worked at Multnomah County for 12 years, including as director of the Multnomah County Health Department and the director of Multnomah County's Behavioral Health. Under her forward-looking leadership, Ebony led the Multnomah County Health Department during the pandemic with a staff of 1,900 and a budget of over $400 million. She was instrumental in establishing the Behavioral Health Resource Center, which serves more than 1,000 people a week in downtown Portland. Please come forward, and thank you for joining us. Coming back.
Good morning and welcome.
You just need to press the little button.
In here?
It's brand new since you
Okay,
got here.
that's awesome. Okay, everyone hear me now? So first off, want to say good morning, Chair Vega Peterson, Commissioners, and Commissioner Myron. My name is Ebony Clark, and I am the Behavioral Health Director for the state of Oregon. Can I say it's good to be home? So just was honored to be asked to come and take just a few minutes to share and reflect on the tenure of Commissioner Myron. I have some notes because I will talk forever, and I know I don't have a lot of time. But you know what came to mind was thinking about the people and the work that we all are charged with doing, whether it's the board, whether it's the health department, whether it's the behavioral health division, whether it's myself, the state, the behavioral health division at the state. We are charged with centering the needs of the people in our communities at the forefront of what we do, from policy to service delivery. I believe that we are still resetting and finding our legs from the pandemic. And I believe that we are at a critical time in our society where if we just step out on the streets and if we talk to folks and as we engage with other fellow system partners, the need is great, the need is critical, and I know that the people of Multnomah County, our communities and our partners are relying on us in the public arena to be the set of solution makers and leaders to bring forward a new set of policy, strategy, services, and supports to end this disparity that we see in terms of suicide rates, especially amongst young people of color, to see the disparities that we see in terms of those who are impacted by overdose specific to opiates and polysubstance. I've been in this work for 25 years, and I still also have to step back and reflect that we still continue to talk about the same things that we've been talking about for years. And so I know that something can be done. I know that we can be forward-thinking. I will just take a minute because I know, Commissioner Myron, you asked me not to reflect and specifically on you, but I want to just say that I was thinking about, I remember there was a luncheon, and it was while you were running, and I remember looking at you and wondering, like, who is this Dr. Sharon Myron? And I got the opportunity to get to know who Dr. Commissioner Myron is. And what I will say is that when I reflect on my tenure at Multnomah County, what you brought to the table was accountability. What you brought to the table was examples of what it means to be more than a manager. You exhibit what it means to be adaptive in your leadership. You exhibit what it means to be participatory, and you're human. And you do center the work on the people. I have appreciated the push and the accountability that you have brought since you've been at the county. You have always been open and honest. You have always asked hard questions. You have always demanded and expected accountability and transparency. But more importantly, my experience of you is that you have given people a chance, and you are willing to walk alongside and sit alongside to support folks in bringing forward a solution. And I think I would be remiss if I didn't speak to, again, you being open and honest. I think that, what I also appreciate about you is that you always follow up and connect with folks, even if there was a misunderstanding or if there were times where there was additional clarification that's needed, that, again, you're human. You center the work on relationships. And I know that the people of Oregon, the people of Multnomah County can trust you. And I just want to tell you thank you for your service and your dedication. And I will just say that I'm a better person because of you. And like I said, because of the accountability that you expected and that you demanded, it helped propel me to be a better leader and to be accountable in my work. And I want to thank you for that. And then lastly, I'll say is that Multnomah County is always going to be family to me. And the Multnomah County that I know is bold, is innovative, is forward-thinking, and that's the Multnomah County that I know and that I'm always going to support. And so just with that, I just want to tell you thank you, Commissioner Myron.
Thank you, Ebony, for joining us this morning. So next, we're going to have one other individual. We have one other individual who has some comments this morning. And actually, Commissioner Stegman's going to read them, but I'm going to just share who the comments are from. They're not anonymous. Again, like Ebony, when you're here for 8 years, you establish relationships and people you work with, and this is telling about Commissioner Myron, that the other individual whose comments will be read by Commissioner Stegman is DeAndre Kenyanji, who is the director of Multnomah County's Office of Consumer Engagement, having started as one of 2 peer staff members of the county's Behavioral Health Division and working his way to a leadership role as he built the office basically from scratch. DeAndre has navigated the dual roles of having lived experience and working within government structures, which aren't always consistent. And he's done so in a way that is inspiring to all who work with him. DeAndre works directly with and is an advocate for people at the intersection of their identities, recognizing that the best recovery systems are informed by peers from all walks of life. Working with the county's Behavioral Health Division, DeAndre is a fierce advocate for community, diversity, inclusion, and equity. His contributions to the county are innumerable. Commissioner Stegman?
Thank you, Commissioner Brim Edwards, and it's an honor to read these lovely words on behalf of Commissioner Myron from DeAndre. Commissioner Myron, you are more than just an elected official. You are a humanitarian. Your curiosity leads to better systems and better health for all we serve. You lead with your heart, and I do see a heart. You lead with your heart, and sometimes people misinterpret your passion. I think people forget that this is more than statistics. Those numbers on paper are real, are real people in real need of a better continuum of care, and you truly understand that. If you are not the expert in a specific area, you have the humility to find those who are truly leading with their lived experience. You find the champions, you find new leaders, and help develop them, just as you did with me. Commissioner Myron, you have invited me to so many tables, giving me a voice and a platform to utilize it. If it wasn't for you, I would not be the fierce leader I am today. And we're talking about DeAndre. You saw the value in my lived experience. You never tokenized me or thought I was incompetent. You gave me permission to lead with my head and my heart, and now I lead this way on and off the job because of you. You have never been afraid to meet the most vulnerable, show up and put your boots on the ground, drive all the way out to Seaside to a peer conference to introduce me as a keynote speaker. You are willing to go to any length to help people like me, the people who are frequent system users and people who don't even know they need the help yet. I know whatever you'll do next will be phenomenal because you are the hardest working woman I know. Never forget to challenge the current narrative. Never forget that there are people dying while we're trying to come up with a comprehensive plan. And never forget the impact and power you truly carry. My hope is that all the commissioners and electeds get to know the community they serve, see the horrors of addiction and mental health, see the people that our system has failed, and feel the weight of that because that is where our true power lies to change the system. Love, DeAndre, Office of Consumer Engagement Supervisor.
Those are lovely and powerful words, and a tribute to, I think that one of the things that stand out is you see so many people, and people recognize that. At this point, we're going to shift to board comments. That's okay?
Yes, and what's after board comments?
After board comments is we'll provide Commissioner Myron with an opportunity to sort of share her farewell, and we have a video.
Oh, that's all, sounds great.
Okay, is that all right?
Yeah.
And I'm,
Cookies and coffee. Yes.
okay. And I'm happy to kick off unless somebody else wants to go.
You've earned it.
I don't know if I've earned it, but I certainly have something to say. So 2 years ago, when people were encouraging me to run for the commission, I called and met with a whole host of current and former county commissioners as I was thinking about running. And Commissioner Myron, you were one of them. And at the end of a long conversation about the county and how it had the power to change lives and the community for the better, and I was like, yes, I want to do this, because like, you really got me fired up that this, the county did have the resources and the expertise and the mission to make things better. But at the end of that conversation, you said something like, let me know if you have any other questions or need anything. I was like, okay, you probably had no idea that I was going to really take you up on that over the next 2 years. Because you drew me diagrams to explain the ecosystem, shelter, and transitional housing. You answered my basic, and it's like sometimes so embarrassingly basic questions about behavioral health care and like what all those acronyms were. But I'm glad to see even this morning you forgot one of them. You explained to me what sobering was and what it wasn't. You introduced me to lots of different experts, especially in the healthcare field. You pressure tested my ideas. And you bluntly told me when I had a bad idea or I was heading in the wrong direction. When you told me, that's not a thing, I knew to totally drop the idea. Because I was like, well, what about this? And you're like, that's not a thing. It's like, okay, that's, so I appreciate that. I had 30 years of national and local policymaking experience that I brought to the county, but I had so much to learn when I joined the commission. And I learned so much from you. You were sort of like my, hey Siri, and then fill in the blank with a complicated question about the county, healthcare, homelessness, traumatic brain injury, addiction services, systems performance, veterans, and on and on. It was just like, hey, Sharon, I'm wondering about, and I would get this answer back that would be like in layperson's language, that was very responsive, factual, and actually pointed me towards like how I could take actions or how I could make something better. So thank you for being my Hey Siri. And also I really appreciate it. It was challenging to come to the commission, into a commission that had been working together for 6 years and had established ways of working and practices. And I appreciated that you welcomed me and you were open to my ideas, because I had a lot of them. And as I said at the beginning, it's like, I have lots of ideas. Some of them are good, some of them bad, and I appreciate you helping me vet out the bad ones. But you were open to like a new person coming in and looking at things with a different perspective that I brought in different insights. And I also appreciate that you shared my passion for action and results. You made the county better through your service on the commission, and you helped reset the direction for the county and set high expectations and goals for our future work. I'm going to be speak to primarily during just my tenure on the county, because that's all I have, and I know it was 3x'd besides just the time I was here. But I want to say, because of your work, advocacy, tenacity, and critiques, we have a better sheltering and homeless response strategy. We're embracing more forms of shelter, such as Bybee Lakes and micro shelters. We're implementing a better staffing model for our ambulance system, and importantly, making improvements in response times. We're getting better data to inform our work. We're pushing ahead with rebuilding our mental health continuum of care. We're moving forward with addressing the risk of the CEI hubs and establishing a 24/7 drop-off sobering center, all because of your advocacy, the expertise you brought, and your passion for us to not just plan, but actually do. I want to say, I know this as a community member and also as a school board member. During COVID, the county was lucky to have you as a commissioner who is also a doctor, who understood the importance of public health and what the county needed to do to keep this community safe. And as we navigated the issues related to addiction, crisis, and rising fentanyl deaths on our streets, you not only had deep compassion for those individuals gripped by addiction, but you also pushed the commission to examine our practices and, again, take action to address the crisis on our streets. I want to acknowledge the pain and hurt that accompanied October 7th and how actions of some in the community and county impacted you. And that doesn't diminish anyone else's pain or hurt to acknowledge that. Every commissioner brings different traits, skills, and competencies to the board table. Here's what I've appreciated what you brought to the commission. Urgency. You saw the crisis in our streets and neighborhoods, and instead of defaulting to more discussion and conversation, you always defaulted to action. Not next year or some vague point in time, or maybe never, but really, we need to take action now. So urgency. Second, intellect. I mean, gosh, a doctor and a lawyer and a county commissioner, it was always humbling to tackle big, complicated issues with you, because you could go deep on so many topics and sort of how systems work together. And so whether it was advocating for better systems, such as Built for Zero, or analyzing data to get better outcomes, you always brought a ferocious and intense intellect to any discussion. Heart, and this goes to somewhat to DeAndre's comments. Your compassion for those who we serve at the county was always central to your position on an issue and how you showed up. Authenticity. You could take the abstract and make it real. There wasn't a lot of BS in how you pursued things and how you showed up for your community. You told us bluntly what delayed ambulance times meant to real people, and you could relate that to your work when you were practicing street medicine or the ER shift that you just had over the weekend. And finally, courage. It's hard to be the one who doesn't just go along with the group, who calls out when things aren't working, like our ambulance response times, or who notes that we don't have the data shows that we're not making progress. Or frankly, the courage to be the person who frankly says what the vast majority of county residents are thinking and putting it on the table and making us confront it. We all need more courage, because that's what gets us in the uncomfortable position which drives us to do things differently, to take action, and to improve our work, and this community. You've often harnessed the power of one. One leader willing to do some truth-telling when everyone knew things weren't going well and they needed to change. It can be mighty uncomfortable for that leader and everyone else, but it is leading to change and improvements, and you are often the catalyst for that. Now, we didn't always agree in my last 2 years, and your critiques were harsh at times. At one point, I voted for something that you objected to in principle, and I have to admit, your objection was like totally an ouch moment. You never shied away from demanding accountability from others, but also from yourself. And that's what I think made you a really strong commissioner in terms of moving us to action. And when we had those moments when we didn't agree, and when you had a harsh critique for those who didn't agree with you or who had a different position, I will say that I didn't leave thinking, like, there was an ouch moment, but then it was also, it made me reflect on my own thinking, assumptions, and actions. Like, was I living my values? Did I look at the data? Am I all in on getting better outcomes, or did I just take the easy route? So even in your critiques and when we differed, I think it made me a stronger and better commissioner, and I think that's true just overall for the county. You care deeply about the county's mission and service to those who live here. I hope that you have a chance, when you have a little distance from your service, you will clearly see how your 8 years of service as a commissioner has influenced and bettered lives of those of us who live here, and I thank you for that. I'll miss not seeing you at the end of the dais. I also miss, usually I was not always the last person at the meeting. So maybe one of the new commissioners will take that role. I hope you stay engaged in the county's work that you're passionate about. This community needs your intellect, heart, and courage for the work forward. Thank you, Sharon, for your service.
Lori? All right. Thank you. Lori's fine. Well, my words will be brief, but thank you. I think Commissioner Brim Edwards said it very beautifully, the appreciation that we have for you, Commissioner Myron. So thank you for your indelible mark that you have left on Multnomah County and for your 8 years of service. You have approached your role with a tireless drive and a vision to address some of our community's most pressing issues. Your leadership on behavioral health has been unwavering, particularly through your efforts on the mental health systems analysis, as we tee up the expansion of the Behavioral Health Comprehensive Local Plan that we just heard about today. Your determination to improve access to care and provide meaningful solutions for those in crisis will have a lasting impact on countless lives. The urgency you have brought to our most complex challenges will continue to impact our residents long after your term ends. Your work to address the risks created by the Critical Energy Infrastructure Hub will hopefully serve as a blueprint for the state of Oregon to follow suit. This is yet another example of your commitment to safety, justice, and accountability. While we have had different approaches to the challenges before us, I want you to know that I have great respect for your unwavering commitment to your principles. It is clear to me that you care deeply about the issues you have championed and that you have brought a distinct and invaluable perspective to this board. I am grateful for your leadership, and I know that your contributions will leave a lasting legacy in our community. Thank you for your dedication and relentless advocacy for the people of Multnomah County. Your efforts have made a difference, and I wish you all the best in the next chapter of your life. Thank you.
Commissioner. So our relationship far predates my 2 weeks on the county commission. And I've just really appreciated and hope that it continues after. We've had so much intersection around behavioral health and homelessness. From when I was first working at Join, I remember talking with you about all the street outreach work and the gaps that we had in the system and the barriers that we faced as frontline staff. I remember talking with you when I was at the Housing Bureau and we were putting together Home for Everyone and even all the structure around what ending homelessness work could look like. And again, how we needed to address those intersections. And then this morning, we continued that conversation of we're still missing some pieces in those intersections. And I've just really appreciated not only your willingness to always have that conversation with me, but even when we don't agree on approach and really being able to have direct, honest conversations. Not everybody loves a blunt Philly girl, but you certainly do. So I've appreciated being able to have those really important, sometimes difficult and direct discussions with you. And while I've only gotten the opportunity to work with you for 2 weeks, I've appreciated your collaboration. You show up to partner, and we've had really good, meaningful discussions in the little bit of time I've had with you. And I look forward to carrying forward that legacy around behavioral health care. I know Commissioner-elect Moyer comes in with a lot of that as well, and I hope to partner with her as you've shown up to partner with me in this time we've had together. So thank you, and more to come, I'm sure.
That was really beautifully done. I know it's hard when you're new to speak, but I think that was great. So I'm really grateful for this opportunity to get to reflect on your 8 years here at the county and the impact that you have made, Commissioner Myron. I think there's so much to say about your leadership throughout our time together as electeds. I mean, you came in, Lori came in, I came in all at the same time when we were in like the shoes that Commissioner Singleton is and this new board will be in, and learning so much. I feel like more than anything, I think my biggest takeaway from my time in serving alongside you over the last 8 years is just how much you genuinely care about the people who live in Multnomah County. And something that I feel is so similar in the way is that how government can help be, like how government can use its power to create the systems, to create the infrastructure and the partnerships to actually solve the issues that are impacting people's lives so much. And especially, I have admired the way that you have really focused your energy on those people who are the most vulnerable and the most, that where our services are the most critical, whether that's seniors, whether that's people experiencing homelessness, whether that's neighbors who are really have no recourse against, large, business corporations that are like, setting up fossil fuel in their neighborhoods, right? I think that's a drive of everyone who seeks office, is the desire to improve people's lives and do so in our ability to change what's happening through our positions and use that to the fullest. And I will say you have used that to the fullest in your role. And I think that what I've especially appreciated is you've applied that desire to connect dots across systems and within systems to really focus on solving those problems that are the most tenacious, including behavioral and public health. The engagement that you have done across our homelessness system, especially the street level interventions, the micro-village investments, and expansion of that system. And really, I think a really great example of the way that that intersection between sectors and issues is the work on FUSE, right? The frequent user system engagement, to really map and address the needs of people at the crossroads of the systems and those systems where you have done such incredible work. But I've also, over the last 8 years, have gotten to work with you, not just on those top priorities for you, but on so many different areas where I've seen you lean in with curiosity and with energy and with tenacity. And I remember a really early thing you did was the displays of wild and exotic animals. And and I see some of your staff folks here from back in the day, and I was like, oh, working on animal issues is hard. And you just took it right up. I think the work that you did around exploring municipal broadband and the needs around Multnomah County is really important. And within your district, there's been so much, but I think the renaming of the Sauvie Island Bridge to the Wapato Bridge And, some of these other issues have been not just beneficial for the district that you've represented for the last 8 years, but for Multnomah County as a whole. And I'm really grateful that we have gotten to partner on things like the wood smoke ordinance, on the safe disposal sites. We have fought for not just on policy issues, but on budget investments. And there have been so many proclamations that we have done together, and most recently on the financial assurance policy and that work that will continue with the next board as well. And you have my commitment to that. I think the common thread is really your sincere desire to listen to what's important to your constituents, to the people of Multnomah County, and really your willingness to say yes to taking big challenges, big and small challenges. You obviously speak your mind, you engage your values, and you've brought many other leaders and thinkers to the work that we do at the county, I think to the betterment of all of us and the work that we do. I think that, we at the board sit at this place where we do have to connect the dots across different programs where, like, the work of our departments is to really go deep into the work. But I think that you have really pushed us to connect those dots and to think about the ways that this organization connects the dots, and that's something that has resonated with me in the work that in bringing forward the one county approach as we do this, and that's something that will carry on beyond. But your term in here, but like that priority has been such an important piece. I know you have said, and you said it earlier today, like you ran for office because of your experience as an emergency room doctor and just wanting to really not just change what's happening on the individual level for those individuals, which is of course part of the piece, but about the systems and the power, and that's something that I really believe in as well. This commitment, there's so many ways that desire has played out for the betterment of Multnomah County, and I think you and I have definitely not always agreed on about the specifics on the best ways to serve and support our neighbors. I have always appreciated the shared commitment to public service and the strong desire to make a difference. That is work that you have brought, and that is an attitude you have brought every single day to this job over the last 8 years, and that has made such a difference to Multnomah County and to the folks that you've represented so well. There is a quote, and I know that the people on the board have said it before, but activist Maggie Kuhn has said it: leave safety behind. Leave safety behind. Put your body on the line. Stand before the people you fear and speak your mind, even if your voice shakes. When you least expect it, someone may actually listen to what you have to say. I think that is an apt way to summarize how your approach to leadership has served Multnomah County while you have been in this elected role, and will continue to service all of us as the public in the years to come beyond your role here at Multnomah County, whether it's the work that you do in the emergency room, your role as a practitioner of street medicine, or in any of the other leadership roles that you take on next. So I just want to say how grateful I am to have had you for a colleague over these last years, and really thank you so much for your service. Thank you. And now it's your turn.
It's my turn. I'm kind of speechless, obviously. But when I'm speechless, it's only because so much is going through my mind that I just can't get it out. I'm just so grateful for all of your incredible words and for your camaraderie and partnership, even when we've disagreed over, some of you, 8 years, which is crazy, and some of you, a couple of weeks, but longer. And it's like, I'm gonna miss you guys, but I just thank you so much for those comments. They mean so much to me, and they will always be in my heart. So it's, I have some remarks that I don't even, it's, this whole thing, this whole process is really very surreal. It's hard to believe. It's been 8 years. Like, it feels literally like just yesterday when we were in your position and like learning the ropes, going to visit the bridge office and being like, bridges, wow, county does bridges, and it's, it just seems like yesterday. And yet it's not. We've been through so much, including racial reckonings and, global pandemics and a homelessness that is so profound and harms so many people. When we started, I came in, in the ER seeing the opioid crisis, and sort of at that point, it was prescription opioids, and that's sort of what I'd been working on. And I was saying, also, what about that meth? Methamphetamine, it's really, really bad. It's a bad actor. We need to be doing something. And then now, then fentanyl, opioid, but different. Opioid, but really potent and bad. And so it's just been so many steps along this path. So when I was first informed there was going to be a recognition sort of ceremony, my initial reaction was, oh, really? That's not a thing that I'm always comfortable with, which is why I'm wearing a shirt that says, seek discomfort. I am here in discomfort right now. And I didn't want to have it be just sort of, superficial, talking about like, oh, here's the slideshow of happy board meeting, and all of these things. I wanted it to be real, and that's when it really hit me that I didn't want it to be about sort of as political, but I could maybe flip the script and make it about the people we serve, the people on the front line doing the work, the people living in our county. And so I felt like that's what we could elevate and speak to, and as new board members are coming on that actually know the work on the front line, that they can carry in their heart and soul moving forward to be their North Star of what we do, to bring a sense of urgency to the work of the county, and to take those steps forward. I invited people to speak today who have inspired me as I've walked alongside them and looked up to them and watched them lead and stand alongside others. And Judge Waller was the one person who could not make it today, and she is a role model, but it is people who are at the intersections of our systems, because that's where it matters. It really is, it's not just homelessness alone. It's not just addiction or mental health or, our criminal justice system or public safety or community justice. It's all of those things together. And Judge Waller, DeAndre, Ebony, all see that, and they've taken their experiences and are leading to put the pieces together. And they speak to why I ran for this office. It's not, I'm not good at the bullshit. At the politics. I'm not good at it, and but I do speak my mind even when my voice shakes. That's my favorite quotes, because we have to speak for the people who need the support and aren't able to come to our board meetings or write to us or speak for themselves. And those are the people I do see on the streets when I do street medicine, in the ER when they come to the ER, because there's nowhere else for them to go, and then they languish there. So many people coming into the ER suffer from what we call the social determinants of health. Those are things like not having a roof over one's head, not having a job, being discriminated against for your disability, not being able to afford heat or air conditioning. ER is not equipped to handle those things at all, let alone handle them well or appropriately. And so people end up in this place that's too often the most expensive and least effective place to deal with their underlying issues. They walk in the door, we send them right back out again in this revolving door. Sort of thought the county was where I could make the difference, because I saw not only where the problems lay, but where we could intervene to make that difference in the real world with real people. I thought I could bring those decades of experience working in exactly the areas the county serves to inform policies so that we could intervene upstream, put people on a different and better path. Many more people than I would see in the ER put a Band-Aid literally and figuratively on and send out the door. And so I was right, but I was also wrong. The county turned out to be more of a challenge, I will say, than I expected, but for different reasons than I expected. I still remember my Willamette Week endorsement interview when I first ran for this seat, I guess 9 years ago. And hopefully Eric Zimmerman will be tuning in, new city commissioner, who was in that same interview. And Nigel Jaquist asked me if I thought it would be frustrating to work at the county. I acknowledged it, I was like, well, as an ER doctor, generally kind of an impatient person, for those of you who know me, I would undoubtedly find the bureaucracy somewhat frustrating. I was trying to be diplomatic, but it would be okay. I was working with people who had similar values and were seeking to improve lives. But I sort of didn't expect, I feel, was a lot of the disarray and dysfunction of the systems that are out there to support people, supposedly support people, meant to support people. I felt, I was like, there's a real focus on some of those shiny new objects, the one-off projects that cost a lot of money, and it seemed like some of our basic foundations were falling apart. There's been an unprecedented turnover of leadership in all of our departments. And that's not good. Anyone who works in big organizations or systems can say turnover is both a symptom of something wrong, and it is also just harmful in and of itself, because it's like, oh, there's a new person to ask the same questions, but they have to, get up to speed. It's really, really challenging, and it's been challenging for me, especially in the health department, which is like, that's what I came here for. It's like behavioral health. There were, I think, 7 different health department directors in the time I've been at the county for 8 years. It's not functional. And, I feel that some of the data that I am presented with at the county is not rigorous. I've spoken about the budget process, and I will, leave that, but I have suggested ways we can improve that. But it is that giant pile of program offers not related to policies or connected to each other that don't result in actual sort of plans or change. But, and there were also things that were challenging that I would see communicated by the county that I felt weren't accurate, that didn't actually jive with what I was experiencing on the street, with what people I knew were experiencing on the street, with what I was seeing in the real world. And that was really, really hard to see that. there was so much that in the beginning, I felt like, oh, maybe I just don't get it. And I'm new. You know a lot more than most, though. But new commissioners coming on, it's like, it's going to take a little while to learn the ropes, and I'm going to trust in X, Y, or Z. I tried to follow the processes of the county. I tried to, I trusted. And then as I asked more questions along my years, and either didn't get answers or got superficial answers or didn't get to the heart of what the real issues were, or I would put forth proposals about what I felt were the real issues that just kind of weren't placed on agendas and stuff. It was like, this is really, really, really challenging for me. I have not been in a setting like this, ever. And so as that continued, I felt like my only recourse was to try to speak out and to put things out there in public to the extent they would be questioned or asked about, or have other people feel encouraged that they could maybe come out and speak their minds, even if their voices shook, because someone at the county in leadership was setting that path, was setting an example and saying, it's okay, there's this stuff we need to reckon with. And it's true throughout our systems. It's addictions, mental health, it's homelessness, it's domestic violence prevention and response, it's youth systems, it's aging and disability services, veterans, corrections, health, county health clinics, animal services. And so it's been a long road of seeing some things that have, I feel, put us on a precipice of some real existential challenges and threats, frankly. I feel that there are issues that are not unique to Multnomah County. I feel that Multnomah County has sometimes often been uniquely bad at responding to them. And I think that it is done damage, it is harmful, and now I come to the actual hopeful part of my message, which, yes, it is a message of hope. Because despite the odds, people have taken on the issues that matter. I've never seen more people in one place who care about issues than at the county, that care about the people we serve. There is a commitment to make lives better for people. I'm inspired, with our incoming county commissioners that I feel will take the reins and not start from the beginning, but recognize so much of what has been done and run with it. And that gives me hope for the future. I feel like, recognition here of some of that work and the foundations I've laid during my years are ready to go. And I think the right people are coming in to take those and run with them, as I said. There's the behavioral health systems transformation work, which we have a blueprint. Let's follow it, take that action. We identified, I work with people on the front line, the leaders doing, the advocates, the people with lived experience of these, of addiction, mental illness, got them together. They created a substance use disorder continuum for us. Like, we don't even need to actually engage. It's like, okay, here is this, we have it. They identified priority investments for the board of what our systems needed, both emergently, what we invest in now as cornerstones that will set a foundation for the future. We have it. We have a comprehensive concept of how to address homelessness, not just shelter or just a certain type of shelter, not just housing or a certain type of housing, but all of it holistically together, from prevention of homelessness, whether from institutions or from housing, to safety, if people are living on the streets and are transitioning out quickly, hopefully, to shelter, to that transitional thing they need to continue on the trajectory upward, to housing that they need, whether it's just rent assistance, whether it's rent assistance plus minor services, rent assistance plus major services. There's an approach that we can do actual built for zero. I know I talk about this a lot, but it's the real built for zero, like what was intended of identifying proactively the people living unsheltered in our community, our neighbors, not just how many there are, but who they are, what they need in order to move forward through our systems and transcend so many barriers in their paths. We can do that. I have budget amendments I put forward, so I can reshare those. Fuse, as you mentioned, Chair, which I really appreciate, based on the frequent users of multiple crisis systems. In the ER and at the state, I'd put forward a statewide program to identify frequent ER users. So we would see, when they come into the ER, they would be identified, we could click on a thing, and we would see what their needs were, and they were ideally connected to a plan, a coordinating plan for them that met their needs. Great for the ER providers, the front line. It was great for the people because their services were coordinated and someone understood what was going on. But what if we did that for people cycling through homelessness, people cycling through ERs and hospital systems, and people cycling through our criminal justice system, getting booked into jail? And looked in that Venn diagram, that central point. What if we actually invested what it took to help those people and expand those systems? And we are finally investing in that. Addressing the existential environmental threat through the CI Hub, as mentioned. And so a lot of this exists. I've posted some things around the room. There are some booklets to take, and I'll offer more if people want them. I want to call out Nitya, who has an incredible, she's a facilitator who does so much incredible work, but for youth mental health forums that I sponsored with Senator Wyden back just literally, I think it was a day before the COVID started. But she created in real time from a youth mental health forum pictorial, like these beautiful murals that show what youth are saying, over 200 of them from all walks of life. We don't need to hypothesize what youth need for mental health issues. We know, they've told us. It's posted in the conference room. I hope you'll take a look. It's just beautiful. So we have all of this, a substance use disorder continuum, a homeless comprehensive plan, a shelter strategy, et cetera. And I hope that these policies will be pursued with our new board. And our new commissioners may not know everything about the county. It's literally taken me 8 years. I mean, there's still so much I don't know, frankly, but I feel like I'm starting to get a handle on it just as I'm going out the door. But our new commissioners really do have a handle on so much as they're coming in the door. And they are dedicated to learning and just diving in. And I've so appreciated Commissioner Brim Edwards, Commissioner Singleton, and I'm just excited about that new commitment and spark and leadership. You can make the county that center of excellence that it has been in the past, that Director Ebony Clark spoke to, a center of innovation and leadership that can be like a beacon. I don't like to say the word beacon. I have some trauma associated with that word, which some of you, it might might recognize, otherwise you'll be like, what's she talking about? But it can be a true beacon of hope and leadership and expertise and excellence that the state, the nation look to advance our work in these essential systems supporting people who are our most vulnerable, marginalized, and historically underserved in our community. So collaboration is essential to the work. And in terms of collaboration, I feel like that's authentic collaboration. You know, the real, it's like having the blunt conversations about stuff where you really don't agree and saying, okay, we're gonna talk about this. Maybe I'm gonna say it wrong, but I'm gonna speak my mind anyway because it's so important, and hope that we can engage around that and collaborate to get to the solutions that exist. All of the problems we're experiencing, while deep, are solvable. And there are paths forward that are actually straightforward, even for complex issues. We need to follow those paths. So I will just finish with 3 of my favorite quotes, which are, if you come to a fork in the road, take it. That is what I'm going to be doing as I step off of the board. And for incoming commissioners, I hope you do that as well. I want to, speak your mind even if your voice shakes, which is just so precious and speaks to the fact that it's hard to speak out, especially when the people who you feel like you're speaking in it against are your friends, are people with aligned values, are people who you care about. It's harder then. Like, it's easy to speak about Trump's policies, frankly. It's like, okay, I can say anything, that's easy, but speaking about policies where you care about your colleagues, your friends, it's hard, and we need to do it. I know our incoming commissioners will do it. And then the thing there's a little sign in my office that says, if you change nothing, nothing will change. And what more need be said? It's absolutely true. And not just change superficially, like put different paint on the house or whatever, but actually change fundamental structures and ways of doing business. When we do that, we are going to move forward. And just a little anecdote, as I really am finishing, that in my office and I want to acknowledge my incredible staff over the years, which I will do in a second, but someone had mentioned, I have my little sign, it's up here actually. It says, if you change nothing, nothing will change. But it was hidden, like I had something in front of it, so people just saw, nothing will change. And so one of my staff people, I was like, God, oh my gosh, Commissioner Myron, I'm so glad that it says if you change, that you took that away, because I thought you was a pretty depressing message. And I'm like, yes. No, if you change, nothing will change, but otherwise things will change. So now just gratitude. I have to express to so many people, too many people to name individually here, but I'm going to try with some. So county leaders who have shown up, done their best to steer this ship, and who have been so collaborative and met with me over and over and over, even in issues where we didn't agree, to inform me and help me make decisions, to the just individual employees at the county who have confided in me over the years and sought me out and trusted in me and supported me, who often are doing their best in systems that frankly don't support them. The volunteers at Animal Services who have gone above and beyond the call of duty, so above and beyond for so many years to serve the animals in our care and entrusted to us. And there's a group sitting there that I'm just looking with such fondness and respect and appreciation. the partners in organizations, leading organizations that are crucial to the work of the county. And so again, seeing so many here, I don't want to like, Bo Brinson, you're just right in front of me taking over with Oregon Recovers. What an incredible organization doing so much good where we can partner and do so much more together. The frontline workers who are out there every day just confronting the barriers and doing the work anyway. It is inspiring. And then my incredible staff over the years. I'm gonna start, from the beginning. It was Katie Shriver who had to leave, who was here and is just brilliant beyond belief. Renee Uzinga, who has reincarnated and is working in the chair's office and doing a lot of work there. And Kyle Schwab in the back, you're still here, and is now doing incredible work in the DA's office around data and accountability and flow and all of these essential things. You're amazing. And then transitions, truly almost done. But Cynthia Castro, who came in as my chief of staff after Renee left and has been just such an inspiration and a leader and even-keeled, thoughtful partner. And Christina Nieves, who's gone to Metro and had to be somewhere, couldn't make it today. Tabitha Pitzer, who has done so much for my office and ended up having to go to law school, whatever, to make the world a better place and is brilliant. Julian Hanlon Austin, who has been just an incredible support and friend, and now, where is Adam even here? Oh, okay, I'm behind one of my signs. Thank you. Adam Lyons, my current chief of staff, who for my last year at the county has just been, supporting me in so many ways and is so thoughtful and, shares my passion on so much and has such a depth of understanding. And Shelley, I feel like I just saw you. Oh, there, yeah, I did. And Shelley Ashford, who has done so much in so many roles at the county and just came into my office because Shelley showed up everywhere, and I'm like, this person is really amazing. And when I needed someone to step in and take the reins after Tabitha left for law school, Shelley was just there and stepped up, and I've been so fortunate to have you over these years. I've been blessed and privileged and lucky, all of those words, to have fabulous people supporting me in this essential work. My family, okay, I do have to call out, my mom and dad are here. So Jean Myron and Roz Myron, they're there they are. I love you so much, and you kind of made me, I guess, what I am, for better or for worse. And thank you, and I'm just so glad to have you here today. So many others, Dr. Sato, Brian, I'm seeing Elizabeth. It's just like I'm overwhelmed, and Diane Lund, like it's overwhelming. Outside the frame, Scott, and it just like it's so much. Thank you beyond measure. This has been an honor. It's been an honor serving alongside of you all. And, I'm not really going anywhere, so, except for off the dais, but I'll be there kind of talking to you, We'll see how often I show up. Thank you for the privilege of serving this county for 8 years. It's been incredible. Thanks.
there is a slideshow, I believe, that, is that, do we have somebody driving that? Marina? Okay, we have that, and then we will break, then we will adjourn the meeting and have cookies and coffee. So thank you so much, everyone, for being here today. We are going to continue the celebration of Commissioner Myron and her recognition with coffee and cookies in the back room when the doors are open. There being no further business, our meeting is adjourned.